Hello guys, how are you all? Good evening Ashish, good evening Anshul Sharma, Lipika, good evening. Devendra Solanki, good evening. Priyanshu Sagar, Milind, Vanilla, Sheikh Sohel, good evening. Shraddha Anjali Mehta, Shraddha, good evening. Keyur, Kiran Yadav, Divya Jain, good evening. So guys, how are you all? How are you all doing? Have you enjoyed your holiday? Sunday? Yeah. So Allah Datta is asking the lectures. See, Datta, these lectures are mainly intended for those students who are entering into MBBS first year. Okay. So when you enter into MBBS first year, when they teach you, right, you might not understand all the things. So if you have a basic thing, at least know the language of anatomy, then when you enter there you will study the detailed anatomy there, and who is going to teach you the detailed anatomy or whatever subject it might be? I am going to teach you. Okay, so these sessions are just temporary sessions to keep you engaged till you enter into your MBBS. Okay, so basically my lectures are completely detailed. Okay, so you can see the previous lectures which I've recorded on YouTube, so they were completely detailed, right? So you can find if you really want to, if you really have a good basics and want the detailed lectures, then you can have those detailed lectures on the same channel itself. Okay, they are very detailed. So these are mainly for MBBS first year. Now directly if I tell what is duodenal atresia, most of you might not understand. So you have to know first of all what is duodenum, what is atresia, right? So the same thing goes on. Ria Singh, good evening. Osama Sheikh, good evening. Good evening, good evening, good evening. Right? So it is raining heavily outside here. So let me also know that whether it is raining for you too. In Hyderabad, it is raining too heavy. Hi, Felicia. Yes, Devendra, I'll be teaching in KSMA. I'll be teaching in all the universities of ISM, right? So my classes are going to be every month there. So 1 month I'll come to teach a subject for you, and after that I'll go to another university, teach a different subject. So in the same way, I keep on rotating all the universities. Okay. Sethi Usman, you can get my full lectures on an app. Okay, we are going to release an app very soon. So in that app, you will have my detailed lectures of anatomy, microbiology, and pediatrics. Telegram group is already there, Ricky. Telegram group is already there. चलो let's start now, है ना? बहुत बड़ा topic है आज. So let us, for the sake of, let us say, Allah Ditta, he wanted to me to discuss in the university science wala, in the university face to face we'll be interacting and we'll be discussing, not in the office. Okay, chalo, for the sake of Allah Datta, we shall be discussing the today's topic in much more detail, है ना? So guys, today's topic, I'm promising you, by the end of this topic you will at least know how to read an x-ray, right, and how to diagnose minimum cases. Okay, chalo, let us start now. Okay, now coming to the upper limb, let us completely discuss from the basics of upper limb. Okay, from the basics of upper limb, मतलब upper limb कहाँ से develop होगा, from there we shall start discussing. Okay, now all of you, yes, in offline only, offline I will talk to you. If science wala is sitting in front of me, I'll talk to you and I'll teach you. Okay, don't worry about that. Chalo, so first of all we have to know what are the mesoderm derivatives. In your plus 1 plus 2 you studied what is ectoderm, what is mesoderm, what is endoderm, है कि नहीं, है ना? So we shall discuss that a little bit and see from which mesoderm derivative our upper limb and lower limb are derived. Okay, so for that first of all let me draw this picture over here. That is a very good university in Lahore. Even a few of my friends are also there. So this picture, whatever I'm drawing, guys, this picture which you can see here, in the center, right, in the center, I'll be drawing NT. NT matlab neural tube. Okay, NT matlab neural tube. Neural tube के नीचे यहाँ पे we have got a small cord. Okay, this cord is called as notochord. I hope all of you know what is notochord. I hope all of you also know what is neural tube. Okay, now in the same way you must also might be knowing what is ectoderm, mesoderm and endoderm, है ना? What I'm trying to do is, see this one, whatever is there, this is called as ectoderm. Okay, and this one whatever is there, this is called as endoderm. So ectoderm or endoderm के बीच में जो है, that I should call it as mesoderm, right? So this entire part is called as mesoderm. Entire part is called as mesoderm. Okay. Now what I'm going to do is that, I hope all of you are writing, guys. I want you to write this down. Okay. What I'm doing is that I'm just drawing a line in the center of the axis. This is an axial line which I'm drawing. Okay. Now concentrate here carefully. Anything which is on side of the center line, the center line is called as axial line. Anything the side of axial line, should I call it as lateral or should I call it as para? I should call it as para-axial line, right? So this part, whatever I'm drawing right now, right? So this part is called as para-axial line, right? And ये para-axial line कहाँ पे है? Where is this para-axial part is present? In the mesoderm. So I should call it as para-axial mesoderm, okay? I should call this one as para-axial mesoderm, para-axial mesoderm, okay? Now, next important thing is anything which is completely away, complete to the extreme, you know, away from the midline. Anything which is away from the midline, I told you in the first class, you should call it as lateral, you know. So anything which is away from the midline here, this part is called as lateral. And this mesoderm is called as lateral plate mesoderm. So this one over here is called as lateral plate mesoderm. Lateral plate mesoderm. Anything between paraxial or lateral, दोनों के बीच में, right, in the center, whatever this part is there, right, this one which is located in the center, it is located in between both of them. So can I call it as intermediate mesoderm because it is located in the center, right? So this part over here is called as your intermediate mesoderm. Intermediate mesoderm. So how many mesoderms do we have? How many mesoderms do we have? Devender, Solanki, tell me how many mesoderms do we have? We have got three important mesoderms. One is called as paraxial mesoderm. Another one is called as lateral plate mesoderm. Another one is called as intermediate mesoderm. Okay, three mesoderms we have got. Okay, so now from these three mesoderms, what are the derivatives we will see now? Okay, so first of all, let me write it as paraxial mesoderm. Okay, after that lateral mesoderm or lateral plate mesoderm. Okay, and finally we have got intermediate mesoderm. Intermediate mesoderm. Okay, now from this paraxial mesoderm, you know what will develop? Skeletal muscles. Okay, so from paraxial mesoderm, skeletal muscles will develop. So if someone is asking you what are the structures that are developed from paraxial mesoderm, you should tell them as skeletal muscles. Now, okay. Now in intermediate mesoderm, what does it develop from the intermediate mesoderm? You know, the genitourinary system develops from the intermediate mesoderm. Genitourinary system. Okay, so your genitourinary system develops from the intermediate mesoderm. So upper limb and lower limb develops from the lateral plate mesoderm. Upper limb and lower limb. Okay, this is a very, very important question. I will also make you to do the questions today. Okay, chalo. So what are the things we have discussed, guys? We have discussed that there are three different types of mesoderms. Paraxial mesoderm से क्या आएगा? Skeletal muscles are derived from paraxial mesoderm. Upper limb and lower limb is derived from the lateral plate mesoderm, and the genitourinary system is derived from intermediate mesoderm. Okay? Now, important question. Another important question which you need to know is that from when does upper limb development start? Okay? So upper limb development start. Batao, from when does upper limb development start? Anyone? Very good. It starts by the end of 4th week. Okay, upper limb development starts by the end of 4th week and lower limb development starts in the beginning of 5th week. ये देखो, ये दोनों confusing terms है. Okay, upper limb development, lower limb development. Upper limb starts at the end of 4th week. So end of 4th वीक से अपर लिम का डेवलपमेंट शुरू होगा एंड बिगिनिंग ऑफ 5th वीक से लोअर लिम का डेवलपमेंट शुरू होगा, राइट? सो लोअर लिम development start by the beginning of 5th week. Beginning of 5th week. Okay, it starts in the beginning of 5th week. So I want you to understand these two important things. These two are very important MCQs. Okay, very good. Dita, Allah Dita, very good. Osama Sheikh, very good. Kiran Yadav, fun mode, perfect. So these two things I hope you understood. From when does this development starts, right? So we just discussed 3 MCQs. एक यहाँ पे है, right? 2 MCQs we have discussed is this one and this one. Okay? So you are clear till here, right? Now what we shall do is that we shall do 2 important MCQs, okay? And you will answer me. So let me select now itself. Divyansh, Kati, Sheikh Sohail, Usman, Fun Mode, right? Cheguri, Princey, Lipika, you guys will answer me very fastly, okay? So ye batao, tell me this question over here. Lateral plate mesoderm and paraaxial mesoderm are the derivatives of, batao, both of them are the derivatives of what? So what are the structures that are derived? Jaldi batao. What about the remaining, Lipika? Very good, very good, very good. Very good. Upper limb as well as skeletal muscles. Very good. Upper limb as well as skeletal muscles, right? So Aladita, everywhere the paper is tough. Everywhere the paper is tough. But we are not at all teaching based upon only the Indian pattern, right? As this is a clinical exam everywhere in India. So we are completely teaching in a higher standards, okay? So you'll get to know what are these higher standards in a minute. Don't worry about that. So coming to the true or false statement, guys, development of upper limb starts at the end of 3 weeks. True ki false? Yes, false. Development of upper limb starts at the end of 4th week. Is it true? Very good. This is true. Development of upper limb starts at the end of 5th week. Again, false. Lower limb starts at the end of 5th week. False. Lower limb starts at the beginning of 5th week. True. Right? So I hope you understood these two important points. Right? I hope you understood these things. Very good. Guys, if you have attended my last class, right? In the last class, I told you one very important thing, that we have got scapula. Scapulas usually develop in the cervical region. Around 9 to 12 weeks of gestation, kya hoga? Scapulas from the cervical region, they descend down to the thoracic region. Agar descend nahi hua, then what will happen? Out of 2 scapulas, 1 scapula is descended down and 1 scapula is in the neck. So that condition, you call it as high level scapula, or you can also call it as, what is that? Not winging of scapula. No, not winging. Winging of scapula is different. Very good, Fun Mode. That is called as springal deformity. Okay. Springal deformity is where one scapula is on the top, one scapula is at the normal position. I hope you remember this from the previous class which I discussed, right? Previous class I've discussed a different thing, right? So now we shall do what are the questions that were asked previously in the exams. Agar if you were able to do these questions, it means you are able to do the clinical questions. You are understanding the clinical questions. Okay? This is how the questions will be placed in the exams. Now, all of you just look at this question which I am discussing now. Okay? अब ये देखो, 5-year-old patient presents to the orthopedic clinic, okay, with shoulder asymmetry. What do you mean by shoulder asymmetry? Shoulder asymmetry मतलब ऐसे, है ना? एक shoulder ऊपर, एक shoulder नीचे. Shoulder asymmetry is there. And limited abduction. The patient's parents explain that this deformity has been present since birth. क्योंकि ये problem 9 to 12 weeks के time पे शुरू हुआ था, right? So it used to be till birth. And now the child is unable to reach overhead and participate in a play. He is not able to reach his hand overhead. क्यों? क्योंकि scapula is obstructing that area. Right? On examination, the left scapula is elevated. Right? Which of the following is the most common associated finding on further imaging? Very good. Very good. Kiran Yadav, Lipika, very good. Cervical spine abnormality, and this condition you call it as springal deformity. So this is the image which you can see. Okay. You see one scapula is here, another scapula is here. right? So this condition you call it as springal deformity. Very good, very good. Now let us see how many of you will answer this. Okay? Which of the following conditions is characterized by failure of scapula to migrate caudally? Caudally matlab niche during the fetal development. Batao. What is the answer? Excellent, excellent, very good. Springal deformity. Springal deformity. Fun mode. Again, just look at the question. It is not Poland. It is springal deformity. Guys, now whatever I'm going to tell you, just look here. Okay. For your FMG exam, okay, pehle FMG exams used to be like this, that there used to be just one word questions, okay, fact based questions. Fact based questions matlab ye second question jo maine karaya tha aap logo ko, this second question is a fact based question. So these were the questions which previously they used to ask. Now the questions are completely clinical setting questions, right? So that in the next exam whatever you will be facing are clinical questions. How is a clinical question looking? This is how a clinical question looks. So this is one example of clinical question. Is this question having any kind of x-ray or any kind of image? No image, no x-ray. Okay, but there are other clinical questions where they give you x-ray or an image. Okay, we will do those clinical questions also. Now just look at this. 8-year-old boy presents with extreme shoulder motion. Extreme shoulder motion मतलब उसका shoulder बहुत freely move हो रहा है ना, extreme shoulder motion and frontal blousing. A chest radiograph is shown. What is the most likely diagnosis? एक chest का एक x-ray दिया है. Now they are asking what is the diagnosis. So this is the third type of clinical question which they gonna ask you. Okay? So this is how the questions will be asked in your exam, guys. Okay? Now look at this and tell me what is the difference you find. अब ये बताओ. First of all, look at this x-ray and tell what difference do you find here. No, answer, not answer, guys. Don't tell me the answer. Just tell me what is the problem here. In this x-ray number 1, what is the problem? So they are telling that here there are absence of clavicles. Guys, this is a normal x-ray, ठीक है? ये है normal x-ray. This is normal x-ray. Clavicles are present over here. ये देखो, है ना? Now compare this x-ray with this one. ये देखो यहाँ पे. Do you have any clavicles at this location? Clavicles are absent. What is the condition where the clavicle is absent? I told you. Yesterday, previous class, I told you absence of clavicle is called as cleidocranial dysplasia or cleidocranial dysostosis or dysostosis, है ना? You remember that? Cleidocranial dysplasia or cleidocranial dysostosis, if you remember. Very good, very good, very good. So, very good. So this is how they're gonna ask you the questions, right? Guys, if you directly by heart the questions, it is not gonna be useful. So if you study the concept first, okay, if you study the concept first and then if you study the question, then it's gonna be really benefit you. Okay, this is gonna be really useful for you. Okay, chalo, hypoplastic. Ashish Lohar is telling the correct thing. That is hypoplastic clavicle. Very good, Ashish. Very good. Ricky, yes, this is actually this entire material, whatever I have clubbed up is from Vishram Singh as well as Gray's Anatomy. Okay? So the clinical part is here and Vishram Singh is also here. Right. Now the next important thing we shall be talking is the humerus. Okay? Now, previously I have told you already regarding the bones, right? Now, just a small brush up, guys, just a small brush up. In this, I told you, this is called as a head. Okay? This is called as a head and these two are called as a condyles. Now, this part where I'm holding exactly is called as the surgical neck of the humerus, right? This is called as a surgical neck. And this is called as your anatomical neck. I told you there can be also fractures of surgical neck. And this is called as a mid shaft of the humerus. There can be fracture here. And I also told you anything which is more protruding outside, that is called as medial epicondyle. देखो यहाँ पे compare this one with this one, this is more protruding, so this is called medial epicondyle, this is lateral epicondyle. दोनों में compare किया तो medial epicondyle fractures are more common, I told you, right? 3 fractures we discussed now. Fourth fracture is ये दोनों condyles है ना, just above these condyles, this area is called supracondylar region क्योंकि above है supracondylar region. So here also fractures can happen. So how many fractures? 4. Surgical neck fracture, fracture in the shaft, right? Fracture of the medial epicondyle, fracture in the supracondylar region. Now what we shall discuss is that अगर fracture हुआ तो क्या होगा? What will happen? Which nerve will be injured in a fracture? We shall be discussing now. Okay. But before I discuss that thing, one very important thing you should know that here exactly here, this part is called as axilla, you know. Within this axilla, there are few important nerves. The nerve that is located in the axilla is called axillary nerve. Okay? फिर से बोल रहा हूं. Nerve that is located in the axilla is called axillary nerve. Nerve that is passing this side is on the radial side of the bone is called as radial nerve. Nerve that is passing on the medial side of the bone is called as medial nerve. मतलब exactly pass नहीं होगा, just for you to understand I'm telling. Exactly passing, not exactly passing. Passing on the radial side is called radial nerve. Passing on the medial side is called as median nerve. Okay? Ulnar nerve, sorry. This is called as ulnar nerve. And nerve that is passing exactly in the center is called as median nerve. Clear till here? All of you are clear till here? Right. So let us put those things on the paper over here. Okay? So first of all, this is the humerus. This is the humerus which you can see here, right? Now within this humerus, this part is called as medial epicondyle. Medial epicondyle, okay? And this part in the center, you call it as the mid shaft region, mid shaft of the humerus. And this part which I'm highlighting with the yellow, this part is called as a supracondylar region. Supracondylar region, okay? And again, this dotted lines, whatever I'm putting right now, this is called as the surgical neck of the humerus. Surgical neck of the humerus. शुरू हो गया. Surgical neck of the humerus, right? Now, just look at the nerves, okay? There is a nerve that is passing exactly near the surgical neck, okay? There is a nerve that is passing along the surgical neck, and this nerve you call it as axillary nerve, okay? What is this nerve you call it as? You call this nerve as axillary nerve. So let us put these things aside. Very good. So you call this nerve as axillary nerve. Okay? So if in the exam they ask you, अगर patient को surgical neck fracture हुआ, right? If there is a fracture of surgical neck, then which nerve will be injured? Axillary nerve. Okay? Axillary nerve. Next, if the patient is having fracture near the mid shaft, okay? So exactly here, see? If the patient is having fracture exactly here, the nerve that is passing here is radial nerve. The nerve that is passing is radial nerve. So mid-shaft fractures will lead to which nerve palsy? Radial nerve palsy. Okay? Paralysis of radial nerve. Next important thing is, there is a nerve that is passing just above the medial epicondyle like this. This nerve is called as ulnar nerve. This nerve is called as ulnar nerve. Most of you, by accidentally, you might get a hit to the table or to the chair, or let us say to the door or almirah, whatever it is. You sometimes feel a shock in the hand, a current shock like thing in the hand. That is nothing but irritation to ulnar nerve. Okay. And finally, in the supracondylar region, if you look here closely, there is two things that are passing. Okay. What are these two things? Are, first is, there is a nerve that is passing here, I told you, right? This nerve which is passing from the center is called as median nerve. Median nerve ke saath saath, there is also an artery that is passing down, and this artery is called brachial artery. I know it is a little bit confusion for all of you. Just look at whatever I'm doing here. See, here in the axilla, the nerve which you have is axillary nerve. The artery which you have is axillary artery. Okay? Finish. Next, from the axillary artery, here you enter into the brachium. This part is called as a brachium. In the brachium, the artery that is present is called brachial artery. Okay? Next, artery that is present on the radial side is called radial artery. Artery that is present on the ulnar side is called as ulnar artery. Nerve that is present on the radial side is called as radial nerve. Nerve that is present on the ulnar side is called as ulnar nerve. है ना? एक ही कंफ्यूजन होगा, ब्रेकियल नर्व क्यों नहीं है? दिस इज नॉट ब्रेकियल नर्व, दिस नर्व इज लोकेटेड एग्जैक्टली इन द सेंटर, सो यू कॉल इट एज मीडियन नर्व. ठीक है? आई होप दिस एक्सप्लेनेशन इज क्लियर फॉर ऑल ऑफ यू, है ना? चलो, so here we discussed axillary nerve, radial nerve, and what will be here? This is called as brachial nerve, not brachial nerve. This is brachial artery and median nerve. Median nerve plus brachial artery. Median nerve plus brachial artery. Okay? Median nerve plus brachial artery. Clear, all of you? Right. So if there is a fracture of the supracondylar region, if for example in a patient, if you see a fracture in the supracondylar region, then what are the two things that will be affected? Median nerve as well as brachial artery. Okay. If there is a fracture of the medial epicondyle, which nerve will be affected? Ulnar nerve. If there is a fracture of mid shaft, which nerve will be affected? Radial nerve. Sir, why did you draw the radial nerve in the dotted line? Reason is that this picture, whatever you can see right now, this is the anterior surface of the radius. What is this? This is the anterior surface of your radius. Okay. But behind the radius, behind the anterior surface, posterior surface hoga na, wahan pe you will see the radial nerve that is passing. Okay. So for example, let us say, as you can see here, right, this is the anterior surface of the radius. Okay. This is your anterior surface of the radius. Back of this here, you see a nerve that is passing like this spirally, and that you call it as a radial nerve. That you call it as a radial nerve. Okay. Right. Sir, how does radial nerve pass? Radial nerve will pass through a small groove. If you can see here, there is a small groove here. Okay. This groove is called as spiral groove or radial groove. Through that spiral groove or radial groove, this nerve passes, that is called as radial nerve. Okay. What is this groove? Radial groove or spiral groove. Okay. Sir, where is it located? On the back, posteriorly. Posteriorly. Right? Now, if you understood this, guys, I'll show you some x-rays and you will diagnose and tell me kaun sa problem hua. Right? Now, before I tell you that, one additional thing I want to add up here. What is that additional thing? That additional thing is that I just told you, agar surgical neck fracture hua, then axillary nerve will be damaged, right? Along with the axillary nerve, there are two arteries here. What are those two arteries? One artery from the anterior side, ye anterior hai na? From the anterior side, it is making a circle. This is called as anterior, making a circle, so you call it as circumflex humeral artery. There is another artery that is going from the back, posteriorly it is making a circle. You call it as posterior circumflex humeral artery. So anterior and posterior circumflex humeral artery are also present near the surgical neck. So if there is a fracture here, along with the axillary nerve, even these two arteries might also be damaged. Okay? These two arteries might also be damaged. So along with axillary nerve, you will also see anterior circumflex humeral artery and posterior circumflex humeral artery. Fever of cricket, groove matlab, see, anything, any shallow depression is called as a groove. Okay, this shallow depression is called as groove. Clear, all of you? Anything which is shallow is called as a groove. Clear? Right. So, very good. So now all of you just look at an x-ray, but by the way, tell me, before I show you the x-rays, you understood this part over here? This part you understood? Yes? Yeah? Very good. Now let us look at an x-ray. Now you will answer me, you will directly tell me which nerve is injured. If I ask artery, you should tell me which artery is injured. Okay? Right. Now look at this X-ray and tell me which nerve is injured. I mean, guys, I'm not telling 100% there will be a nerve injury, but if there is a nerve injury that can be associated with these fractures, okay? पक्का अगर जिसको भी whoever is having surgical neck fracture, there is a nerve injury and all. No, it is not 100% sure. Okay, there can be, there might not be. But very good, you're answering perfect. Very good. So this fracture is an axillary surgical neck fracture, and in this surgical neck fracture, axillary nerve is injured. Tell me which arteries are injured here. बताओ जल्दी, which arteries are injured? Anterior as well as posterior circumflex humeral artery. Very good. Anterior, posterior circumflex humeral artery. Very good. Very good, Sirimalle. Very good, Akshaya. Nitin, perfect, Nitin. Very good. Chesley Panchal. Very good. Very good. Now look at this X-ray, guys. Look at this X-ray. X-ray number 2. Is this same? If it is same, write it as same. It is not same, then write the answer. I'm asking which nerve is injured here. Very good, very good, very good, very good, very good, very good, excellent. Shraddha, very good. Kiran Yadav, Vanilla, Priyansh, Usman, very good. Everyone good. Okay. Now let me show you another X-ray if I have. Okay, ये बताओ. Tell me which nerve is injured in this X-ray. कौन सा nerve है जो injure हुआ यहाँ पे? What is the nerve? Very good. That is a radial nerve. Very good. A radial nerve injury. Okay, this is a radial nerve injury. Very good. Now, guys, this X-ray, most of you will be confused. What is this X-ray? Is that from the side they have taken a picture. Okay, when you take a picture from the side, what are the things you're gonna see? You're gonna see humerus, right? And you're gonna see here two bones. What are these two bones? This bone which you can see is your ulna, है ना? इसके पीछे जो है, what is that bone? Radius. ठीक है? So this is your humerus bone. This is your humerus bone, and this is your ulna, and this is your radius bone. Okay, so exactly above the condyles you have got a fracture like this, and this fracture is called as supracondylar fracture. And by the way, tell me in supracondylar fracture which artery might be injured? Which artery injured हो सकता है? कौन सा artery? What is the artery that can be injured? Adnan, very good, Adnan. Neha Anjum, tell me. Cheguri, very good. Brachial artery, okay? Brachial artery can be injured. So there are chances that brachial artery can be injured. Very good. Brachial artery can be injured. Very good, Urvi. So if which nerve will be injured, if I ask, what will you tell me? Which nerve? Very good. That is the median nerve. Median nerve will be injured. Okay? Right. Abhi ye batao, what is this X-ray again? Again you see fracture has happened in the mid shaft. मिड शाफ्ट मतलब रेडियल नर्व, सो फिर से रेडियल नर्व इंजुरी. ओके, अगेन रेडियल नर्व इंजुरी हो गया. ओके, नाउ टेल मी दिस वन गाइस, टेल मी, ये बताओ, टेल मी दिस थिंग, टेल मी दिस थिंग, विच नर्व इंजुरी हैज वुड हैव हैपेंड ओवर हियर? नहीं है, रेडियल नर्व नहीं है. वेरी गुड, वेरी गुड, वेरी गुड. You see this bone over here is your this is your humerus, right? And you see a little part here. Why there is a little part? Because there is a fracture here, and you see there is a fracture, and this is a fracture of medial epicondyle, and so medial epicondyle mein what is the nerve that is passing like this? Very good, that is your ulnar nerve. Okay, so this is a medial epicondylar fracture, and the nerve that can be injured is ulnar nerve. Okay, there are chances that the ulnar nerve can be injured. Very good guys, very good. And again, I hope all of you know that this is a radial nerve injury where you see a mid shaft fracture of the humerus. Mid shaft fracture of the humerus. Okay, so these are the enough examples to tell you what are the fractures and what are the nerves that are associated. ठीक है, बस ये याद रखो, ये काफी है. When I keep on teaching the entire muscles. Okay? When I teach you the entire muscles, that time you'll understand all the actions of the muscles. है ना? That very moment, I will tell you radial nerve injury. है ना? That time you will know radial nerve is innervating which muscle. So उसका action भी पता है तुम लोगों को. That time I will tell you something called as wrist drop, something called as ulnar claw, radial claw, right? Complete claw hand. These things step by step will frame it up. Okay. But till now, what you need to understand here is that you need to understand these things. Right. You need to understand this thing. Nitin, Usmania Medical College. I have practiced in Usmania Medical College as well, Nitin. Everything is good, but except the buildings. We used to wear helmets and practice there. है ना? चलो. Right. So next important thing is my entire family studied in Usmania only. Next important thing you need to know that, guys, for example, I had supracondylar fracture. Okay. Now, when I have supracondylar fracture, I will go to a local doctor. Okay, who have no idea about what is supracondylar fracture. He doesn't know what is the median nerve, what is brachial artery, nothing. Okay, but उसने क्या किया? What did he do is that he applied a slab for me with a plaster of Paris. Okay, now he did a lot of padding. Padding मतलब बहुत सारा cotton रख दिया, right? He made many rounds of this slab, right? Plaster of Paris. He rounded this plaster of Paris many times, and finally, whatever it is, finally he made my arm completely compressed. Okay, the bandage, whatever you have kept here, this bandage is highly compressed. So this is called as a compressive bandage. अगर compress हुआ तो within my arm जितने भी compartments है, all these compartments also will be compressed. Right? When you're putting a tight POP, tight plaster of Paris, don't you think the artery which is supplying the remaining part of the limb, that artery will be compressed? अगर ये artery compress हुआ, do you think the forearm will receive the blood supply? No. अगर forearm को blood supply नहीं मिला, then what will happen? After a long time, in the long run, the forearm muscles, they undergo atrophy. I told you what is atrophy is in the first class, na? So they undergo atrophy. Okay. So now just look at how does this atrophy look. So this is how it looks. You can very clearly see that the forearm compartment muscles are atrophied. You see the thin forearm compartment muscles, right? So there is a complete atrophy of the forearm compartment muscles, right? There can be many causes, guys, but one of the cause I'm telling you is a tight compression bandage. Okay, that would lead to a syndrome called compartment syndrome. Compartment syndrome मतलब हाथ में जितने भी compartments हैं, all of them they'll be compressed. ठीक है? चलो. So very good, very good. So you're also answering is this condition you call it as Volkmann's ischemic contracture. Volkmann's ischemic contracture. Okay, this condition you call it as Volkmann's ischemic contracture. Okay, most commonly seen in the patients with supracondylar fracture. Most commonly seen in the patients with supracondylar fracture. Okay, so all of you understood this till here? Very good, Shraddha. Very good. Necrosis will cause due to lack of blood supply. Excellent. You're right. Okay. Now the next important thing is कभी कभी क्या हो सकता है? There can be calcium depositing in the muscle. Muscle में कभी calcium deposit होगा? Will there be calcium depositing in the muscle? No. Calcium should deposit in the bones. ठीक है? अगर muscle में deposit हुआ, then how does the muscle look? The muscle becomes very hard. है ना? Calcium. How does a calcium look on a X-ray? Bones look white. Yes or no? So wherever there is calcium, that looks white. So if calcium is in the muscle के area पे you will see some white color thing. That is called as calcium within the muscle. Just look at an X-ray. ये देखो, है ना? So you can see very clearly that there is a white cotton ball like thing that is present over here. है ना? So this is nothing but calcium getting deposited in the muscle. This condition you call it as myositis ossificans. This condition you call it as myositis ossificans. Clear? All of you are clear till here now? Guys, just I need a green signal from you. Before I start on the next, before we do these questions, I just need a green signal. All of you understood ki nahi? Yes or no? Yeah, it can cause any problem. Devendra, I was telling you, जब यहाँ पे fracture होगा, here median nerve and brachial artery are present. Okay, so if you are putting a tight bandage to a patient, ठीक है, so when you are putting a tight bandage to a patient, क्या होगा? Then the brachial artery will be compressed. When not only brachial artery, median nerve भी compress होगा. चलो median nerve तो छोड़ दो. We are talking about brachial artery. Brachial artery compress होगा. अगर brachial artery compress हुआ, not only brachial artery, along with that all the muscles जितने भी है यहाँ पे, all the structures, everything will be compressed. So this condition you called as compartment syndrome. So जब compress होगा, obviously brachial artery will divide into two arteries. One passing to the ulnar is called ulnar artery, another passing to the radial side is called as radial artery. तो यहाँ पे blood supply नहीं होगा. अगर यहाँ पे blood supply नहीं है, then what will happen? The forearm muscles will become atrophy. That is what I told you. है ना? चलो. I hope you understood now. चलो ये question, let us see this question, guys. 7-year-old child is brought to the emergency room by his parents in severe pain. ठीक है? They state that he fell on his outstretched arm. Guys, अभी तक जितने भी मैंने nerve injuries बताया था, right? All the nerve injuries, whatever I told you, all of them, the common cause is fush injury. ये देखो, fush. Fush मतलब sound fush नहीं. Fush मतलब fall on outstretched hand. ठीक है? Fall on outstretched hand. So, they state that he fell on his outstretched right arm while playing with his friends. You see, there is a history of fall on outstretched hand. Hai ki nahi? So, whenever you read a question, when you find a history, immediately you need to go into that topic. Now, he is unable to move his right arm, which is being supported by his left. Okay. On exam, his vitals are normal. His right extremity reveals normal pulses without swelling in any compartments, but there is crepitus above the elbow. है ना? Crepitus मतलब पता क्या? Whenever there is a bone fracture, you catch that bone and you try to shake it. You try to move it. है ना? You will feel somewhat some stone-like feeling you will have. Okay, let us say put 10 to 20 stones in a bag and try to palpate it. The feeling whatever you get, that is called as crepitus. Or simple thing I can tell you is that you put a bag of worms and try to palpate it. Okay, the feeling whatever you get, that is called as a crepitus. Okay, so where is the crepitus? Crepitus is above the elbow. Above the elbow matlab yahan pe, this is elbow, right? Above the elbow matlab this is the place. Yes or no? So here there is a crepitus. So his right extremity reveals normal pulses without swelling in any compartments, but there is crepitus above the elbow upon the movement. Okay, the child is able to flex and extend his wings. There is a swelling above the elbow. Ab batao which is the most commonly seen here. What will be the answer? Very good, very good. The answer will be supracondylar humerus fracture. Very, very, very good. Very good. Supracondylar humerus fracture. Next important question is, a 78-year-old woman is brought to the emergency department by her grandson. ये देखो, सुनो अच्छे से. Brought to the emergency department by whom? By grandson after sustaining a fall. Okay, the grandson reports that the patient was walking into the living room when she tripped and fell on a rug and landed on her right side. ठीक है, ऐसा गिर गया on the right side like this, right side. He denies witnessing convulsions or loss of consciousness. The patient did not hit her head nor have episodes of incontinence. She denies confusion, dizziness, chest pain, shortness of breath or palpitations. है ना? There is bruising on the lateral aspect of her right upper extremity. So यहाँ पे there is a bruising, red color bruising. Okay, range of motion of right shoulder is limited. A plain radiograph is obtained. एक बार X-ray दिखते क्या है ये? You see the X-ray? भाई look at the X-ray and tell me कौन सा fracture है ये? What is the fracture here? जल्दी बताओ फ्रैक्चर कौन सा है ये? Very good, very good. So this is a surgical neck fracture. Surgical neck fracture. ठीक है? So he is asking which is the following fracture which you can see here. Obviously ये कौन सा fracture है? Surgical neck humerus fracture. Fracture number 4. Surgical neck humerus fracture. ठीक है? So all of you understood now? Now guys, you got a clarity that how clinical questions will be asked. है ना? There are image based clinical questions, there are non image based clinical questions, there are questions which are just lengthy, है ना? So at the end of the day, what you should know? Concept पता होगा तो then you can easily understand the questions. ठीक है? Very good. So this one we shall discuss it later on. ठीक है? We shall discuss this later on. Now let us move on to the next important thing. Let us move on to the next important thing. ठीक है? Later on क्यों, ये अभी डिस्कस करेंगे. ये देखो 48 year old male returns to your office 8 months after sustaining a proximal humerus fracture. अब ये देखो proximal distal क्या है? Anything which is towards the body is called proximal, anything away from the body is called as distal. तो proximal मतलब यहां पे होगा, है ना? So fracture हुआ था पहले इसको and he was successfully treated non-operatively. However, he is still having persistent anterior dislocated anterior pain that worsens with most activities. He has not done any physical therapy or not received a corticosteroid injection. ठीक है? What nerve passes along the surgical neck? बताओ, आंसर बताओ जल्दी, फटाफट आंसर. What is the nerve that passes along the surgical neck? Axial नहीं रे, axillary. Axial नहीं, मैंने बहुत बार लिखा हूं axillary करके, है ना? यहाँ पे भी है axillary. Axial क्या है? Axial. Don't give shortcuts. ठीक है? You are the guys who are entering into MBBS first year, है ना? शॉर्टकट में लिखना, that thing you can do after your MBBS. ठीक है? अभी कोई शॉर्टकट नहीं है. चलो, now let us discuss another important thing, another important fractures. Just look at whatever I'm telling you here. Stop commenting guys. चलो, stop commenting and एक बार देख लो यहाँ पे क्या हो रहा है. ये देखो, two important bones you have got, radius or ulna. We shall see what are the fractures that are located in radius and ulna. First important thing is that, for example, if I'm putting my arm like this, right? Let us say if I'm putting my hand like this, okay? Now, if I'm putting my hand like this bone, whatever you can see right now, this is your radius bone, right? This is your radius bone. Now, for example, if I got a fracture of my radius bone, so let me remove my watch over here, है ना? Let us say I've got fracture of my radius bone. अगर यहाँ पे fracture होगा क्या होगा? This part of the radius bone will be tilted up or this part of the radius bone can be tilted down. है ना? ये जो fractured fragment है ना, it can either look up. Is it going up, or it can, there also can be chances that the fragment can displace downwards, right? So the same picture, let me put it over here. Now just look at this. This is called as, this is your radius. ठीक है? ये कौन सा बोन है? Radius है. And this is your arm. ठीक है? Let us say this is some rough picture I've drawn. ठीक है? So this is the way I'm putting my hand. अगर if there is a fracture exactly here, now two things can happen guys. What are those two things? Either this fractured fragment, right? Either this fractured fragment can be displaced upward like this, or the fracture fragment can be displaced downward like this. Let us say the fracture fragment here is displacing upwards in this way. ये fracture fragment जो है it is displacing upwards. Now when the fracture fragment is displacing upwards, swelling कहाँ पे होगा, ऊपर होगा कि नीचे? Swelling will be also on the top, right? So if you look at the swelling also, even the patient is having swelling on the top like this, right? So overall if you look at the hand exactly, this is how it looks. So this is your arm, this is the patient's arm. Swelling कहाँ पे हुआ, ऊपर है ना, ये देखो swelling is on the top, right? Swelling is on the top, and these are his fingers, 1 2 3 4 5 fingers. Okay, now isn't this fracture looking like a dinner fork, है ना? Isn't this fracture looking like a dinner fork? Dinner fork जैसे दिख रहा है ना? Yes or no? So let us write some important things about this fracture and I'll show you the fracture. The first important thing I want to write you here is that this is a distal radial fracture की proximal. Distal हुआ कि proximal हुआ, बताओ? Fracture happened proximally or distally? Be fast. I want all first years, right, pre-MBBS students to answer here. Very good. Fracture has happened distally. Distally to which bone? Distally to the radius bone, है ना? Distal radial fracture. इसका नाम है distal radial fracture. Second thing, ठीक है, फ्रैक्चर हुआ, दैट फ्रैक्चर फ्रैगमेंट एंगुलेटेड. एंगुलेशन कहां पे हुआ? डॉर्सल एंगुलेशन हुआ कि वेंट्रल एंगुलेशन हुआ? ऊपर गया कि नीचे? ऊपर, दैट इज डॉर्सल एंगुलेशन. सो डॉर्सल एंगुलेशन ऑफ द फ्रैगमेंट. ठीक है, डॉर्सल एंगुलेशन ऑफ द फ्रैगमेंट. एंड थर्ड इंपॉर्टेंट थिंग ये है गाइस, I told you, मैंने पहले क्लास में ही बोला था कि whatever you are seeing on me right now, this is a normal anatomical position. ठीक है, और यहाँ पे जितने भी muscles है ना, these are all called flexor muscles. They are responsible for flexion of my body, right? On the back side, whatever you cannot see in the camera right now, on the back side, that entire region is called extensor. And क्यों extensor क्यों बोलते हैं? Because that entire region is having extensor muscles that are responsible for extension. ठीक है, now when the fracture fragment has moved up, when it is moved up, this part is the extensor part. If it is moving down, this is called as a flexor part. So the fracture fragment has moved up. Now tell me, is this an extensor type of injury or flexor type of injury? Batao. Tell me, is it an extensor type of injury or a flexor type of injury? Very good. Very good. Lipika, all of you are understanding? First years you are understanding? Yes or no? Very good, very good. First years, I want only first years to answer. Are you understanding? Very good. Here, extensor, you're right. You're all right. This is extensor. This is extensor fracture. Okay. And fourth important thing ये है कि this is extra articular. Extra articular fracture. Sir, what is this extra articular? Extra articular मतलब it is not involving the joint, है ना? That is why it is called as extra articular. ठीक है? क्योंकि बाद में I will discuss the fractures which are intra articular. Okay? चलो, this thing you understood, है ना? Now let us look at the patient. Let us look at the X-ray also. Now this is an X-ray, right? Now whatever bone you can see right now here. Now this is an X-ray which is in this position. Now whatever bone you can see here, this is called as a radius bone. Can you clearly look at an fracture here, guys? Yes or no? मैंने जो fracture बोला, can you look here? Yes or no? Can you very clearly look at the fracture? Be honest. Don't tell answer to satisfy me. You be honest. Very good. There is no fracture क्योंकि ये normal X-ray है. This is a normal X-ray. ठीक है? This is a normal X-ray. Very good. Very good. Now look at this X-ray, guys. In this X-ray, if you very closely look, you see the fracture fragment that is displaced upwards. Yes or no? Fracture fragment has been displaced upwards. अगर fracture fragment ऊपर displace हुआ, can you see a swelling here? Can you see a swelling on the top? Right? Now, can you also see a depression here? And these are your fingers. All of you know this, right? So isn't it looking like a dinner fork? ये देखो, isn't it looking like a dinner fork? So here patient was having a fracture like this, and this fragment displaced upwards in this way, right? So overall this fracture is looking like a dinner fork deformity. So this fracture is called as Colles fracture. Okay, what is this fracture called as? Colles fracture. Clear, all of you? This fracture is called as Colles fracture. So in Colles fracture, what kind of deformity you see? I see dinner fork deformity. Dinner fork deformity is seen here. Okay? So previously I told you the fracture fragment was displaced upwards. Now I am telling you fracture fragment is displaced downwards. If the fracture fragment is displaced downwards, what will happen? See, this was a fracture, and now I am telling you that the fracture fragment is displaced downwards. अगर downward displacement हुआ तो swelling कहाँ पे होगा? Swelling will be on the down. These are the fingers, right? Swelling will be on the down. Yes or no? This fracture you call it as Smith fracture. This fracture you call it as Smith fracture. So let us write down some of the important points in Smith fracture. First important point. Smith fracture is also fracture of proximal radial or distal radius. It is a fracture of distal radius. Distal radius fracture. Okay. Second important thing. और ये भी extra articular है. Even this fracture is also extra articular. Extra articular. Okay. Third important thing. You will tell me, is it an extensor type of injury or flexor type? बताओ. Anything which is on the top is called as extensor. Anything which is on the bottom here, you call it as flexor. Now tell me, the fracture fragment is looking downward or upward? Downward. Very good. So this is called as a flexor type fracture. Flexor fracture. This is a flexor fracture. Okay. So all of you look at these pictures, guys. You can see here swelling on the top. You see swelling on the top. Swelling on the top मतलब कौन सा fracture होगा? ये dinner fork deformity, Colles fracture. Okay. So this is also Colles fracture. This is also Colles fracture, which you can see here. Okay. Now look at this fracture and tell whether this is Colles or this is Smith. Look at the distal fragment. ऊपर है कि नीचे है? नीचे Smith, ऊपर Colles. Tell me. I know most of you will be confused. I know this. Okay. To avoid confusion, let me do this thing. Just look at the fracture fragment now here. Okay. Now compare these two x-rays. If you look at this x-ray over here, ये देखो fracture fragment जो है, this is on the top. Okay, fracture fragment is on the top, you know this. Now look at this x-ray over here. In this x-ray, if you see fracture fragment, it is on the bottom. Yes or no? Fracture fragment नीचे है. So this is what? This is a Smith fracture. If you look at the fracture clearly, you'll understand. That last small part, balloon like part, whatever is there, if it is on the top, Colles, if it is on the bottom, Smith. ठीक है सर? याद कैसे रखना है which is Colles and Smith? You know two cricketers. Who are those two cricketers? One is called Virat Kohli, another one is called as Smith, है ना? Obviously both are best cricketers only. अगर इन दोनों में comparison किया तो who is on the top? Kohli is on the top, Smith is on the bottom. The same way here also, Colles fracture is dorsal displacement, Smith fracture is ventral displacement. ठीक है? All of you understood now? Clear, all of you? Understood what is Colles and Smith? Very good, very good. So Smith fracture, Colles fracture is called what? Colles fracture is also called as dinner fork deformity. Now I'm telling Smith fracture. Okay. Smith fracture is called as garden spade deformity. Garden spade deformity. Garden spade deformity matlab, just look at this garden spade. How is it? First of all, it is straight. Okay. There is a little bent down and again it is straight. Yes or no? Look at the hand also. First of all, it is straight. There is a little bent down and again it is straight. So what kind of deformity is it? It is dinner fork deformity. Clear? So this is dinner fork deformity which you need to know. And ये वाला X-ray देख के बताओ, what is this? I told you already this. I've already told you this thing. Tell me, what is this? I'm waiting for your answers. Anyone, any answer other than fun mode has given? फीवर देखो फिर से. कौन सा डिफॉर्मिटी? लास्ट क्लास आई टोल्ड यू. Divya Jain, very good. Fun mode, very good. Very good. Anterior bowing of radius. What do you call this anterior bowing of radius as? Anterior bowing of radius, you call it as what? Very good, Shraddha. Alia Khan, very good. Made lung deformity, excellent. So in this made lung deformity, you see the ulna bone which is perfectly straight, the radius bone has made a curve, right? Yeah, baby, ulna bone is perfectly straight and you see this curving of the radius bone. So this kind of deformity, you call it as made lung deformity. You call it as a made lung deformity. Very, very, very good. Made lung deformity. Very good. Right. Made lung deformity. Okay. Now the last two fractures we will discuss. Uske baad we will enter into the muscles of upper limb. Okay. Now coming to these two fractures, very easy, very simple fracture. Okay. What I will do is that I will put two lines over here. What are those two lines? You know that ye wala hai radius and this is ulna bone. Okay. So there is a fracture exactly here. Okay. And there is a problem exactly here. Now what are these two lines? First of all, let us decode one by one. Now this line, whatever I have drawn here, this one, this is an upper or lower part of the ulna. Upper end of the ulna, yes or no? I should call that this is an upper end of the ulna. Exactly speaking, upper third, yes or no? Upper third of shaft of ulna. Upper third of shaft of ulna. Plus, and here there is a joint. Okay? ये कौन सा जॉइंट है? जॉइंट बिटवीन द ह्यूमरस एज वेल एज द रेडियल हेड. यस और नो? अब बताओ, दिस लाइन वॉट एवर आई हैव ड्रॉन हियर, दिस इज अ प्रॉक्सिमल लाइन और अ डिस्टल लाइन? Anything towards the body is proximal, so this should be proximal. So proximal radial head. Proximal radial head. So the complete fracture is, if you look here, that is upper third shaft of ulna fracture, okay, along with proximal radial head dislocation. Along with proximal radial head dislocation. Okay? So together here you call this fracture as Montague fracture. Montague fracture. Okay? Montague fracture. Exactly opposite of Montague fracture. Exactly opposite matlab? Exactly opposite matlab? See, exactly here. Here as well as this part over here. Now write down the exact opposite things. अपर को ऑपोजिट क्या होगा? लोअर. लोअर. अपर थर्ड मतलब लोअर थर्ड. शाफ्ट ऑफ अल्ना, यहां पे शाफ्ट ऑफ रेडियस. ओके, शाफ्ट ऑफ रेडियस फ्रैक्चर प्लस along with that here I have written proximal. Proximal का opposite, what is the opposite of proximal? ఏంటిది? distal. Proximal opposite and it distal. Okay, and there is a joint between radius and ulna. ये देखो, ये ఇది radius and ఇది ulna. Radius ulna రెండిటి మధ్యలో ఉన్న joint radio ulnar joint. Okay, radio ulnar joint. So here I have written proximal radial head dislocation. Now I'm writing distal radio-ulnar joint dislocation. Radio-ulnar joint dislocation. Okay. So E fracture pair ఏంటంటే what is the name of this fracture, and this you call it as Galeazzi fracture है ना. So ఈ fracture pair you Galeazzi fracture. Okay. So where is the moon? Moon is on the top. That is why fracture is always on the top. Moon for Montague. Where is the ground? Ground is on the bottom. Bottom मतलब यहाँ पे. Ground. G for Galeazzi. All of you understood these two parts here, right? Perfectly clear, yes or no? Be first. Jaldi. How many of you are from Hyderabad here? How many of you are from Hyderabad? And how many of you are from Vizag? Very good. Chalo. Now let us discuss another important thing. What is this important thing over here? Obviously, Usmania Medical College, your Hyderabad, I know. Chalo. Another important thing which you need to know here. What is this important thing? Important thing. What is that? Ye dekho. First important thing is that this bone which I am drawing right now is your humerus. This is your humerus. Okay. Now here you know that this is your radius bone. This is your ulna bone. Okay. So this is your radius bone and this is your ulna and this is your humerus, and this part is your medial epicondyle. Medial epicondyle. Okay. Actually, when I was discussing joints, I already told you this thing that from the ulna you have got a ligament. Okay. ये ligament क्या करेगा? It is holding the ulna. Okay. See, for example, I am the ulna. There is a radius in front of me. I am hugging the radius in this way with the help of this ligament over here. Okay. So this is how the ligament is. So this is ulna and this is the radius that is hugging like this. Clear? So this ligament, whatever which I'm drawing right now, this is called as annular ligament. What is this ligament called? This is called as annular ligament. Annular ligament. Okay. Now, important thing you need to know regarding the annular ligament. Okay. For example, in future, when you leave, when you go to hospital, okay, you leave your kids near a housemaid. Now let us say housemaid, one hand she's catching, let us say Cerelac. Now, will she put the Cerelac down and then catch hold of the baby, put the baby in the chair, and again she'll take the Cerelac and go to the baby and feed? No. Housemaids don't have that much time. What they do? They put the Cerelac in one hand and with the other hand they lift the baby up like this. If the baby is crying down there, lying down, they'll just catch hold of the hand and lift the baby up. Now, when you're lifting the baby up like that suddenly, what will happen is that, let us say this is your radius. Surrounding this radius, you have got this, what is this? Annular ligament. So suddenly kya hoga? When you're lifting it up, the annular ligament will be displaced like this. And the radius is completely coming out of this annular ligament. You see, this kind of arm, you call it as a nursemaid elbow. Okay, or a housemaid elbow or pulled elbow. Okay, you are clear with that? You see this. For example, this is the real cadaveric image. Okay, in this cadaveric image, you can see this is ulna. Okay, then where is the radius? See, this is the radius. This is the radius bone. Okay, and what is this ligament over here? This ligament is called as annular ligament. This ligament over here is called as your annular ligament. So what is happening here? This is your annular ligament. If you are pulling the elbow, what is going to happen? You see, annular ligament is slowly slipping off. The radial head is slowly slipping off from the annular ligament, and finally what is happening? Finally what is happening is that the radial head is dislocated. Okay, so why it is dislocated? Because you are pulling the baby like this. Okay, if you are pulling the baby like this, then this is what it happens. So this is also called as pulled elbow, or it is also called as nursemaid elbow. Nursemaid elbow, or it is also called as housemaid elbow. Housemaid elbow. All of you understood this thing? What is nursemaid and what is housemaid elbow? Yes or no? बताओ जल्दी. Very good, very good, very good, very good. Second important thing, guys. Second important thing, ये देखो. These things we have already talked in the previous class. So just to test you, I have put these questions. Now you will tell me the answer. ठीक है? Lipika will tell me the first answer. Lipika, Sirimale, Riya Singh, Rajvardhan, all of you should tell me the first question answer. Come on. Be fast. Very good, Lipika. Very good. So, thickest border of scapula is the lateral border. Very good, Lipika. Lateral border is called as the thickest border of the scapula. Next, most common fractured carpal bone. Most common fractured carpal bone. Very good. That is your scaphoid. Scaphoid is the most common carpal bone to be fractured. Most common dislocated carpal bone क्या होगा? Lunate. Very good. Lunate. Very good. Ashish. Very good, Ashish. Anut Chandran, perfect. Anut, very good. Devendra, very good. Vaishnavi, very good. So, which is the largest carpal bone? Capitate. Capitate is the largest carpal bone. Okay. And first carpal bone to ossify, that is also again capitate. And which is the shortest metacarpal? Yeah, very good. Shortest metacarpal is the first metacarpal. First metacarpal is the shortest metacarpal which you will see. Okay, shortest metacarpal is your first metacarpal. ठीक है? तो यहां तक clear है ना? Now we shall discuss about the muscles of your upper limb. ठीक है? Now when it comes to the muscles of the upper limb, so how do we divide these muscles of upper limb? Guys, when you enter into your first years, वहां पे ऑस्टियोलॉजी के लिए सेपरेट बुक रहेगा, मायोलॉजी के लिए सेपरेट बुक्स, प्लैंकनोलॉजी के लिए सेपरेट, आर्टेरियल सप्लाई के लिए सेपरेट, है ना? तो ऐसे सेपरेट बुक्स रहेगा वहां पे. सो व्हाट यू नीड टू नो इज दैट डोंट ब्लाइंडली फॉलो दैट. ठीक है? व्हेनेवर यू आर स्टडीइंग, डोंट स्टडी सेपरेटली. व्हेन यू आर स्टडीइंग ह्यूमरस, वहीं पे यू शुड नो द आर्टरीज, वहीं पे यू शुड ऑल्सो नो द नर्व्स, यू शुड ऑल्सो नो द ब्लड वेजल्स एंड द मसल्स ऑल्सो. ठीक है? सो स्टडी इन दैट वे इंटीग्रेटेडली. ओके, सो दैट वुड हेल्प. एंड मैं फिर से बोल रहा हूं, राइटिंग नोट्स इज वेरी इंपॉर्टेंट. ठीक है? नोट्स राइटिंग इज वेरी इंपॉर्टेंट. सो व्हेन इट कम्स टू द मसल्स, देयर आर डिफरेंट कैटेगरीज ऑफ मसल्स. ठीक है? पहला कैटेगरी, muscles that are located in the pectoral region. Okay, muscles that are located in the pectoral region, these are called as pectoralis muscles, pectoral muscles. There are muscles that are located in the back. Okay, these are called as back muscles. Next, there are muscles that are located in the arm. Okay, there are muscles that are located in the arm. There are muscles that are located in the forearm. Muscles that are located in the forearm. And there are also muscles that are located in the hand. Okay, muscles that are located in the hand. And finally, we have got muscles that are located on the scapula also, because scapula is attached to the upper limb. So scapula bhi upper limb mein component hai, we should discuss that also. So muscles that are attached to the scapula. So we shall be entirely discussing the upper limb muscles in 1, 2, 3, 4, 5, 6, 6 categories. Okay, pectoral region muscles, back, arm, forearm, hand, as well as scapula. Okay, now first of all, let us concentrate on the muscles of the pectoral region. muscles of the pectoral region. Now, whenever I'm telling you the muscles of pectoral region, important thing to know. Okay. So, in the pectoral region, simple way to remember is that 2P, 2S. What is 2P and 2S? 2P and 2S. This is the mnemonic to remember pectoral region muscles. So P stands for pectoralis muscles. एक बड़ा होगा तो major, एक छोटा होगा that is minor, है ना? So one is called as pectoralis major. One is called as pectoralis major. ठीक है? Very good. Another one is called as pectoralis minor. I will show it to you guys. Don't worry. Pectoralis minor. So after 2P, 2P is done. What are 2S? Two muscles with name S. One muscle below the clavicle. Anything below is called sub, I told you. Or infra. Anything below is called sub or infra. So below the clavicle it is called subclavicular muscle or subclavius. So subclavius. ठीक है? और दूसरा क्या होगा? S also stands for serratus anterior muscle. Serratus anterior muscle. Okay. So how many muscles do we have here? Pectoralis major, pectoralis minor. उसके बाद subclavius, another one is serratus anterior. So these are the muscles which are located over here. ठीक है? So we shall also discuss the clinical points as we will be discussing this. First of all, just look at the pectoralis major. Okay, and मैं फिर से बोल रहा हूँ, origins insertions are not gonna be asked in your exams. Okay, as per the new competencies which are given by the NMC, right? So there, these are not there. Origins and insertions are not there. They are not going to ask you origins and insertions. Sir, from now onwards, I'll not study. No, first year student, you have to study origins and insertions. ठीक है? बाद में भूल जाओ. But first, you have to know it. ठीक है? So let us say that this bone which I'm drawing right now is your sternum. This is your sternum. Okay. All of you know that here you have got your clavicle. This is your clavicle. And you also know that here you have got the humerus bone. This is your humerus like this, right? Now, from where does this muscle start? Okay. So origins and insertions may separately, I'll give you a table, but for now just listen to this, that from the middle side of the clavicle, okay, mid part of the clavicle से ये muscle शुरू होगा. कौन सा muscle? Pectoralis major, okay. So it starts from here all the way, है ना? All the way it enters here, and it also starts from the lateral surface of the sternum, and finally this pectoralis muscle comes all the way and inserts. Guys, origin एक होगा, insertion एक होगा. Origin मतलब from where it is starting. Insertion मतलब where it is ending. That is called insertion. So where is this muscle ending? That is a very important question. So you should know where the muscle is ending. Before to know that, you should know this picture first of all. In this humerus bone, if you closely look, I cannot show it to you here. Okay? I cannot show it to you here, but if you closely look, guys, here you have got one line and here you have got another line. Between both the lines, I told you this is called as bicipital groove. You know? So one is called as lateral lip, another one is called as a medial lip. Okay, so it is actually like this. So let me show it to you over here. So if you exactly look, this is actually like this. Okay, so all the students who have attended my classes previously, they might have known this. Okay, for first years I'm telling you mainly. So this is actually like this. Now this is called as lateral lip of bicipital groove. This is called as medial lip of bicipital groove. This is called as your bicipital groove. Okay, so there is one muscle attached to the lateral lip, there is one muscle attached to the medial lip, and there is third muscle that is attached to the bicipital groove as well. Okay, so let us see what are these muscles over here. Clear? So look here now. This is called as lateral lip. This is called as lateral lip, and this is called as medial lip. Okay, how do you know what are the muscles attached? Only major muscles will attach here. What are those majors? Two majors है अभी तक. एक है pectoralis major, another one is called as teres major. Okay, so just remember the mnemonic MET. MET मतलब met. ME मतलब medial lip. What is ME? Medial lip. To medial lip, which muscle is attached? T. T मतलब क्या? Teres major. So to the medial lip here, the muscle which is attached is teres major. टेरिस मेजर, ठीक है. तो यहां पे टेरिस मेजर है, तो ऑन द लैटरल लिप दूसरा मेजर होगा. व्हाट इज दैट दूसरा मेजर? दैट इज कॉल्ड एज पेक्टोरालिस मेजर. सो ऑन द लैटरल लिप यू हैव गॉट pectoralis major. So this one is attached onto the lateral lip. Clear all of you now? All of you are clear with this, right? Now this muscle which I've drawn right now is a pectoralis major muscle. तो ये कहां पे इंसर्ट होगा? ये देखो, lateral lip, medial lip. बताओ कहां पे इंसर्ट होगा? This will go and insert to the lateral lip like this. Okay, this will go and insert to the lateral lip. So this muscle which you can see right now is called as your pectoralis major muscle. Pectoralis major. ठीक है. I have only drawn this pectoralis major onto one side. ठीक है. Actually onto the other side also you have got pectoralis major, the main chest muscle. है ना. अभी ये देखो, there can be some conditions. What is that condition? Is that by birth itself, out of two pectoralis major muscles, one pectoralis major muscle will be absent. है ना? So this absence of pectoralis major muscle is called as, what do you call it as? You call it as, मैंने ये already बताया था आप लोगों को. I have already ఈ టాపిక్ స్టార్టింగ్ లో డిస్కస్ చేశాను. है ना? ఫస్ట్ క్లాస్ లో నేను ఆల్రెడీ డిస్కస్ చేశాను. ఫస్ట్ క్లాస్ లో చెప్పినప్పుడు నేను ఏం చెప్పాను? I told you that out of two pectoralis muscles, oka pectoral muscle will be absent. Danni emantaru, what do you call it as? Very good, very good. The fever of cricket, fun mode, perfect guys, very good. Poland syndrome, ye dekho. So this condition where one side you don't have a pectoralis major is called as Poland syndrome. Very good, Lipika. So this is called as Poland syndrome. This condition is called as Poland syndrome. In Poland syndrome, you also see another condition. What is that? You see hypoplasia, मतलब underdeveloped fingers. Okay, hypoplastic fingers बोल सकते हैं इसको. Okay, we can also call it as దీన్ని hypoplastic fingers అని కూడా అనొచ్చు. So this is underdeveloped fingers. Okay, so this condition is called Poland syndrome. And exam లో ఏమడుగుతారు? In Poland syndrome లో ఏ muscle absent ఉంటుంది? What is the muscle that is absent in Poland syndrome? That is pectoralis major. Pectoralis major. So I hope you understood this. Okay, pectoralis major. So sir, pectoralis major to ho gaya. You discussed about pectoralis major. Very good, fine. Where is pectoralis minor? If this is pectoralis major, if I am removing this pectoralis major, inside you will find pectoralis minor. Okay, can you show it? Yes, this is a real cadaveric image. ठीक है. इस real cadaveric image में you all of you can see that this muscle which you can see here, right? See, which is going and inserting here to the lateral lip here. This is called pectoralis major. What will I do now is that I will cut down this part. ये देखो, I am cutting down this part like this. I am cutting down this part. Now when I am cutting down this part, what I will do, I can remove it like a fan. Okay, like a flap I can remove it. When I remove it like a flap, this is the next picture. Ye dekho. See here, I have removed this pectoralis major like a flap. After that, you see inside I find one muscle, small muscle here. Right? So this muscle is called as pectoralis minor muscle. Okay? This muscle you call it as pectoralis minor. Pectoralis minor muscle. You're clear with this, guys? All of you are clear? Yes or no? Be fast. Jaldi. Very good, very good. So you understood two muscles, pectoralis major, pectoralis minor. Sir, subclavius कहाँ पे होगा? Clavicle के नीचे होगा subclavius, right? ये देखो sir, यहाँ पे can you see the clavicle? Can you show me? ये देखो, I'm little bit zooming the picture inside, right? Now all of you look, this is your clavicle over here. You see the clavicle? You see this? This is your clavicle. Okay. Just beneath this clavicle, can you find this muscle here? All of you can look at a muscle here. This is called as your subclavius muscle. Okay? Beneath your clavicle, the muscle which you have is subclavius muscle. Okay? Sir, clinical points kya hai? What are the clinical points here? One clinical point I told you is about the Poland syndrome. Okay? The next clinical point. Next clinical point is, look at this man over here. Hai na? The muscles which he is showing here right now is serratus anterior muscle. What is the muscle? Serratus anterior muscle. Okay. So if you look at what is the serratus anterior muscle on the side of the chest, okay, on the side of the chest, can you find these muscles over here on the lateral side, lateral wall of the chest? Ye dekho, these three muscles over here. Actually, not three, there are many. So these muscles which you can see here on the lateral side of the chest, these are called as pectoral, not pectorals, I'm sorry, serratus anterior muscles. So these muscles are called as serratus anterior muscles. Okay. So till here clear? Now, one very important clinical point, every year in anatomy, FMGE, they have given this question. Every year they have given this question. What is the question is that serratus anterior muscle is innervated by which nerve supplies serratus anterior muscle? The nerve that supplies serratus anterior muscle is long thoracic nerve. Okay, the name of the nerve is long thoracic nerve. Okay, what will happen if long thoracic nerve is damaged? If long thoracic nerve is damaged, first of all, you should know that where is this serratus anterior muscle? See, serratus anterior muscle, from here it goes on to the back and it attaches to the scapula. Agar serratus anterior muscle, if it is not working, do you think scapula will work? No, right? If serratus anterior muscle is damaged, do you think scapula movements will be normal or they also will be hindered? Obviously, scapula movements also will be gone, right? And you know what is the use of this serratus anterior muscle? Yes, this muscle can cause a problem. What is, you know, the use of the serratus anterior muscle? For example, if I'm punching someone very strongly, this strong punching action or boxing action is given by this serratus anterior. Now, when I'm punching someone, my scapula is moving forward or it is moving backward like this. Tell me, when I'm punching like this, touch the scapula. Scapula is moving forward. So this forward movement of scapula is called as protraction of scapula. What is that? Protraction of scapula. If I ask what is a powerful protractor in your body? Serratus anterior. Serratus anterior is a powerful protractor. Okay. अगर सेरेटस एंटीरियर मसल डैमेज हुआ, क्यों डैमेज होगा? अगर ये नर्व, this nerve which is supplying this serratus anterior, if this nerve is damaged, serratus anterior muscle cannot work. अगर serratus anterior muscle काम नहीं किया तो क्या होगा? Do you think there is protraction? Can you punch someone or can you open the doors? You cannot open the doors. That condition you call it as winging of scapula. Okay. Now whatever I have just told you, let me put it up there. So long thoracic nerve, right? Long thoracic nerve will be supplied, right? So, and by the way, serratus anterior is a powerful protractor. Okay. It is a powerful protractor of scapula. Okay, that is why serratus anterior muscle is also called as boxer's muscle. Pata? It is also called as boxer's muscle. Yesterday I told you, not yesterday, anytime you will come across what is boxer's muscle. Boxer's muscle matlab serratus anterior muscle is called as boxer's muscle. अगर ये long thoracic nerve damage हुआ, then scapula cannot be held in a position, so scapula will hang down. इसीलिए इसको बोलते हैं complete winging of scapula. Complete winging of scapula, right? I'll show you a picture of that. Now all of you look here. This is a complete winging of scapula. You can see here very clearly. This is a normal scapula. This is a normal scapula here, and this is a winging of the scapula, right? You know what patient will come and tell, doctor, nowadays I'm not able to push open the doors, right? I'm not able to punch someone hardly. Kyun? Kyunki he is having complete winging of scapula. Now what will I ask a patient? Did you have any injuries previously? है ना? Then he will tell, yes doctor, recently I had some injury on the lateral side of the chest. Now as a doctor you should tell him, देखो यहाँ पे एक nerve pass होगा, the name of the nerve is long thoracic nerve, वो damage हुआ, इसीलिए serratus anterior काम नहीं कर रहा है. That is the reason why you are not able to push the doors open. You're clear with this? So this winging of scapula is called as complete winging of scapula. Complete winging. Sir, why are you using all the time this term complete winging, complete winging? Kyunki there is also another winging of scapula that is called as partial winging of scapula. Okay, complete hoga to partial bhi hoga. Partial winging of scapula. So what is causing partial winging of scapula? That is due to the paralysis of trapezius muscle. ये देखो यहाँ पे होगा ना trapezius. See, this is the trapezius muscle here. Okay, so that trapezius muscle paralysis हुआ तो trapezius muscle. Sir, how trapezius muscle paralysis will happen? Because the nerve that is supplying it, if it is damaged, for example, spinal accessory nerve. Spinal accessory nerve, if it is damaged, then it will lead to partial winging. Okay. So from today onwards, two important things you should keep in your mind. Partial winging of scapula, complete winging of scapula. Partial winging में कौन सा muscle? Trapezius muscle. Complete winging में कौन सा muscle? Serratus anterior muscle. What is the nerve here? Spinal accessory nerve. What is the nerve here? Long thoracic nerve. Clear? So all of you just look at this picture over here. I don't have it, or I have it. Right, now in this picture guys, in this picture, if just pay attention to whatever I'm showing it to you, na? Whatever I'm showing you, just pay attention to it. Now I'm zooming in. If you clearly look here, can you find these muscles here? Right, how many? 1 2 3 4 here. Can you find these muscles? फिर से I'm rubbing it out. Just look at these muscles clearly. Again I'm drawing. See these muscles here. Right, so these muscles over here are called as your serratus anterior muscles. Okay, what are these muscles called? Serratus anterior. And after showing you these muscles, can you see a long rope like thing that is hanging down? A white color, blackish or whitish rope that is hanging down. It is passing above these muscles. Yes or no? This nerve is very long and it is located in the thoracic region. So can I call this nerve as long thoracic nerve? So exactly at this region, if I am punching someone यहाँ पे, तो क्या होगा? ये nerve damage होगा. अगर ये nerve damage हुआ, then what will happen? These muscles will not work, and that would lead to complete winging of scapula. Perfectly clear, all of you? चलो अभी जल्दी बताओ. You understood कि नहीं? Fast. After that, we shall do the 2 questions and we shall close up the session now. Perfectly clear, right? Very good, Pawan. Very good. Pawan, Rajmi, Devyanshi, Kati, very good. Right. Very good. So, sir, what are the nerves that are supplying each and every muscle here? How do you know these nerves? To know these nerves, you should know a mnemonic. What is that mnemonic? All of you know ABCD. All of you also know LMNOP, L, M, N, O, P, Q, and so on. Right? So, what does L stand for? L stands for lateral and medial pectoral nerve. Lateral and medial pectoral nerve. M stands for medial pectoral nerve. M stands for medial pectoral nerve. N stands for nerve to subclavius. Nerve to subclavius. O stands for long thoracic nerve. You already know this. Long thoracic nerve. O stands for long thoracic nerve. So this is all you need to know here, right? अब हम करेंगे क्वेश्चंस, ठीक है? Now we shall look at the questions now. Now you will tell me the answer. ठीक है? You will tell me the answer. ये देखो, a healthy 49-year-old photographer presents to the primary doctor for annual physical. ठीक है? When conducting the physical examination, you note that he has decreased range of motion in his right shoulder, along with what is seen in the figure A. ये देखो figure A में ये है. अभी ये figure A में ये बताओ, what is this? What is the problem here? No, I don't want the answer. I just want the problem. What is this figure A? This is complete winging of scapula, है ना? Complete winging of scapula. Now, upon questioning, he reports to have carry a heavy bag containing photography equipment over his right shoulder daily. है ना? Most of you have a fashion of wearing heavy bag on one side and going to the college, है ना? But पता क्या होगा? Two things can happen. One thing, your spine might bend, which is called scoliosis. और दूसरा थिंग ये होगा कि when you are putting a heavy bag onto one shoulder, क्या होगा? The long thoracic nerve will be compressed. If long thoracic nerve compress हो गया, then you can't even open the doors. Okay? So which of the following nerve is affected in this condition? बताओ जल्दी. Very good, Kiran Yadav. Very good, Riya Singh. Very good. So the answer is long thoracic nerve. Long thoracic nerve. ठीक है? So, guys, all of you understood whatever I've taught you today? Right? All of you understood whatever I've taught you today? Completely clear. I know this is a little bit advanced here for you right now only, but I hope you understood everything. Nitin, you understood, Nitin? You understood? Ashish, you understood? Riya Singh? Bhumit, you understood, Bhumit? Shraddha, you understood? And Najmul Hussain, you are late. You are late. How many minutes you are late? That many patients have died. Okay. Don't be late from next class. Sirimalle, you understood? Very good. Devendra, offline classes will start when you go there. Okay. I hope if you are already there, right, in September, we are all meeting back. Okay. September, I'm coming there. September, we are going on 28th August, right? Okay. Obviously, when you go only, I can come and teach, right, offline. I cannot teach you right in your hometown or in the aeroplane. No. When you go there, when you settle there properly, when the schedule starts and all, right, है ना, उसके बाद ही मैं आके पढ़ा सकता हूँ आप लोगों को. So then only I'll also get a schedule that students are settled, now you can go and teach. ठीक है? Then I'll come there. Okay. Right. So I'll also be taking micro as well as pediatrics also. I mean, not for you, pediatrics. Chalo, but for the other students as well. But for you, mostly I'll be taking anatomy. Okay. Yes. Vabau. KSMA also. Kagma State Medical Academy. So there also I'll be coming and teaching you. Okay. Very good. So already in this chat, there are KSMA seniors. There are some of your seniors of KSMA where I have already taught them. So you can ask them also. Rishit Verma, no, I'll be the only one teaching anatomy. Why you did not like the way I taught? You want any other teacher? If yes, then you can immediately inform the department so that they'll change the teacher. Don't worry about that. Priyanshu Sagar, right, very good. Right. Chalo guys, so this is all for today and I want all of you to revise, so take care, goodbye and have a good night.